This video is for educational purposes only and isn't meant to replace medical advice. Always talk to your doctor before making any health changes. What if the air you breathe every morning is quietly tightening your chest? In the next few minutes, we'll decode the surprising science of bronchospasm and show you how to keep your airways open even when the world seems determined to close them. Hello and welcome back to Alpha Health Lab, where we bring you science-backed strategies to optimize your respiratory health every single week. Before we dive in, if you're new here, hit that subscribe button and ring the bell so you never miss an evidence-based health tip. Today we're breaking down asthma, a chronic inflammatory disease that obstructs airflow in the bronchial tubes, into essential segments. Asthma affects over 300 million people globally, so understanding its mechanisms and management can truly change lives. Let's get started. 1. Definition of asthma and normal respiratory physiology. Asthma is a chronic inflammatory disease characterized by obstructed airflow in and out of the bronchial tubes. In a healthy respiratory system, as the diaphragm contracts, air moves freely through the trachea and bronchi, down to the bronchioles, and finally into the alveoli where gas exchange occurs. During this process, carbon dioxide diffuses out of the bloodstream into the alveoli, while oxygen diffuses from the alveoli into the bloodstream, a seamless exchange that keeps your cells energized and your tissues well oxygenated. Millions rely on this finely tuned system daily without a second thought, highlighting its vital importance. Under normal conditions, the bronchial walls, lined with smooth muscle, remain supple and responsive. The autonomic nervous system, the ANS, automatically regulates this smooth muscle. Sympathetic stimulation, your fight or flight response, relaxes the smooth muscle to produce bronchodilation, while parasympathetic stimulation, your rest and digest mode, contracts the smooth muscle to produce bronchoconstriction. Warm, moist, irritant-free air naturally encourages bronchodilation, ensuring unobstructed airflow to fuel every bodily function, from thinking to moving. In other words, a calm ANS balance maintains effortless breathing. In asthma, however, those bronchial walls become chronically inflamed, swollen, and hyperreactive, even between flare-ups. This inflammation thickens the lining and sensitizes it to minor stimuli, meaning everyday irritants can trigger an exaggerated defensive response. As a result, when an irritant appears, your airways respond with exaggerated constriction, significantly slowing or blocking normal gas exchange. Recognizing this altered state of airway reactivity is the first step toward proactive management and lifelong respiratory well-being. Comment "clear air" if you want to learn how to keep your airways open every day. 2. Asthma triggers. Asthma triggers are environmental or internal factors that provoke the already inflamed and hyperreactive airways of an asthmatic person. Outdoor triggers include pollen, especially in spring and autumn, smoke from wildfires or tobacco, air pollution such as vehicle exhaust or industrial emissions, and cold, dry weather. When your air is thick with pollen or laden with fine particulates, the bronchial lining can constrict suddenly, making breathing feel like you're trying to suck air through a straw. Staying aware of local pollen counts and pollution indices can help you plan outdoor activities smartly. Indoor triggers can be equally insidious. Mold spores, pet dander, dust mites, and cockroach droppings settle into carpets, bedding, and upholstery. When disturbed by vacuuming or walking on carpets, they float back into the air. Beyond external irritants, physiological and emotional triggers also play a significant role. Respiratory infections like colds or flu inflame the bronchial lining, making it more reactive for weeks afterward. Intense stress or strong emotions can trigger a sudden tightening of chest muscles, worsening breathing. Managing stress through mindfulness techniques can help lower that risk. Exercise, especially in cold or dry conditions, can provoke exercise-induced bronchoconstriction, so pre-exercise, warm-ups, and correct inhaler technique are essential. When any of these triggers strike hyperreactive airways, mast cells and leukocytes release histamine, leukotrienes, and prostaglandins, fueling inflammation and bronchospasm. Comment "trigger alert" if you're determined to control your asthma environment. 3. Mechanism of an asthma attack. During an asthma flare-up, mast cells and leukocytes within the airways release a flood of chemical mediators, histamine, kinin, prostaglandins, and leukotrienes. Histamine dilates bronchial blood vessels and increases permeability, allowing fluid to leak into surrounding tissue and causing the airway wall to swell. Leukotrienes intensify smooth muscle contraction and promote mucus secretion, while prostaglandins contribute to heightened sensitivity and pain. This chemical onslaught sets the stage for visible inflammation and discomfort. As these mediators accumulate, the smooth muscle fibers encircling the bronchial tubes constrict in a process called bronchospasm. Simultaneously, the bronchial wall thickens as inflammatory cells flood the lining, and goblet cells in the mucosa overproduce sticky mucus. The combined effect, smooth muscle tightening, wall swelling, and mucus overproduction, dramatically narrows the airway lumen, leaving only a small opening for airflow. With the airway lumen so restricted, airflow slows to a crawl, oxygen cannot reach the alveoli efficiently, and carbon dioxide removal is hampered, causing an imbalance known as ventilation-perfusion mismatch. This mismatch in gas exchange causes blood oxygen levels to drop, potentially leading to hypoxemia and severe shortness of breath. Recognizing this cascade early is crucial. Catching these signs at the start can prevent a mild flare-up from escalating into a life-threatening event. Comment gas exchange if you want tips on recognizing early warning signs during an attack. 4. Symptoms of bronchospasm. When bronchospasm takes hold, you typically experience an uncontrollable cough, a high-pitched wheezing, and pronounced shortness of breath. The coughing can be relentless, often so severe that it interrupts normal airway vibrations, further destabilizing airflow. Wheezing, that telltale whistling sound during exhalation, occurs because the narrowed passages force air out more rapidly through constricted openings, and may sometimes even be audible without a stethoscope. Shortness of breath follows from reduced air reaching the alveoli, making you feel like you just can't get a full breath. This sensation often triggers panic, ironically causing chest muscles to tighten further. Chest tightness isn't simply discomfort, it signals that the bronchial smooth muscle is in sustained spasm and the lining is inflamed and thickened. When these sensations intensify, they can lead to rapid, shallow breathing, further depriving the body of adequate oxygen. Many patients notice that these symptoms worsen at night or in the early morning, when natural fluctuations in airway tone and inflammation peak. Suddenly waking up gasping for air, coughing repeatedly, and struggling to catch breath can be terrifying, especially for vulnerable groups like children and the elderly. Recognizing these nocturnal warning signs early and using rescue medication can drastically reduce the risk of a severe exacerbation, improving both sleep quality and overall health. Comment: wheeze watch if you've ever experienced that waking up gasping sensation. 5. Anti-inflammatory medications. Long-acting anti-inflammatory drugs are the cornerstone of asthma management because they tackle the root problem, airway inflammation. Inhaled corticosteroids, e.g. budesonide, fluticasone, reduce swelling in the bronchial wall by suppressing immune cell activity. Over weeks of consistent use, they shrink the inflamed lining, decrease mucus production, and make the airways less hyperreactive to triggers. Many patients notice fewer flare-ups and improved day-to-day breathing after just a few weeks of regular use. Leukotriene inhibitors, such as montelukast, block the action of leukotrienes, powerful inflammatory mediators that intensify smooth muscle contraction and mucus secretion. Disrupting this pathway prevents a significant portion of the inflammatory cascade. Meanwhile, cromolyn sodium, used less frequently, stabilizes mast cells, preventing them from releasing histamine and other mediators in the first place. Though not as potent as corticosteroids, cromolyn can be valuable for mild cases, especially in children or pregnant patients, because it has a favorable safety profile. Importantly, these maintenance medications must be taken daily, even on symptom-free days. They do not provide immediate relief during an acute attack. Their benefit lies in long-term prevention. When baseline inflammation is minimized, the airways become more resilient, dramatically reducing the frequency and severity of flare-ups. Adherence can be challenging, but setting daily reminders and using combination inhalers can help you stay on track. Comment: steroid strong if you're ready to commit to consistent anti-inflammatory therapy. 6. Bronchodilators and developing an asthma action plan. Bronchodilators relax the smooth muscle around the bronchial tubes, opening airways to improve airflow. They fall into two categories: quick relief, rescue, and long-acting, maintenance. Short-acting beta-2 agonists, e.g. albuterol, work within minutes to relieve acute bronchospasm, making them essential during an attack. You'll often hear this referred to as a rescue inhaler because it literally rescues your airway when it tightens suddenly. Meanwhile, long-acting bronchodilators, such as theophylline or anticholinergics, e.g. tiotropium, provide sustained airway relaxation over hours. These agents are typically used daily, often in combination with inhaled corticosteroids, to keep the bronchial smooth muscle consistently more relaxed and the airways less inflamed. The combined anti-inflammatory and bronchodilator approach has been shown to reduce hospitalizations and emergency visits. Equally crucial is creating a personalized asthma action plan with your healthcare provider. This plan should include daily maintenance medication schedules, concrete trigger avoidance strategies like using a humidifier or adjusting pet exposure, instructions on how and when to use rescue inhalers during flare-ups, and clear guidelines for seeking emergency care if symptoms rapidly worsen. Developing and adhering to this structured plan with your doctor's guidance ensures you know exactly which steps to take at each stage of symptom progression. Comment: action ready if you've already talked to your doctor about your personalized asthma plan. 7. Lifestyle strategies to complement medical management. While medications and an action plan form the backbone of asthma control, lifestyle modifications add crucial layers of protection. Avoiding known triggers like smoke, strong odors, and outdoor pollution is essential. Simple changes such as using a HEPA air filter indoors, washing bedding weekly in hot water to kill dust mites, and storing food properly to deter cockroaches can dramatically lower allergen exposure in your home. These adjustments often yield noticeable improvements in breathing comfort. Regular physical activity, especially aerobic exercise, strengthens respiratory muscles and improves overall endurance. Many asthmatics fear exercise-induced bronchoconstriction, but with proper warm-up routines, pre-exercise bronchodilator use, and careful monitoring of peak flow readings, you can safely engage in running, swimming, or cycling. Consistent exercise also helps maintain a healthy weight, which further reduces the strain on your lungs and heart. Stress management is equally critical. High stress and intense emotions can trigger bronchospasm via mechanisms similar to those of physical irritants. Practices such as deep breathing exercises, progressive muscle relaxation, yoga, or meditation help calm the nervous system and lower the likelihood of stress-induced attacks. By combining these lifestyle strategies with your maintenance medications, even simple changes like keeping humidity at proper levels, you create multiple layers of defense, empowering you to maintain clearer airways and enjoy a higher quality of life. Comment: active lungs if you're ready to adopt asthma-friendly exercise and stress reduction techniques. 8. Recognizing when to seek emergency care. Despite diligent medication adherence and lifestyle measures, some asthma attacks escalate rapidly. It's vital to recognize persistent symptoms after using a rescue inhaler. If, after 1 or 2 puffs of a short-acting bronchodilator, you still experience wheezing or shortness of breath beyond 15 to 20 minutes, you should seek emergency help immediately. Waiting too long can risk serious complications. Other red flag signs include a rapid heart rate, bluish lips or fingernails, indicating very low oxygen levels, confusion, or extreme fatigue. These symptoms suggest dangerously low oxygen or elevated carbon dioxide levels, both of which can become life-threatening if not treated promptly. If you see these signs in yourself or someone you're caring for, call emergency services or head to the nearest hospital without delay. It's better to be safe than sorry when breathing is compromised. Finally, ensure that a trusted friend or family member knows your asthma action plan. If you become too breathless to communicate effectively, Having someone else aware of your baseline symptoms, triggers, and rescue steps can be life-saving. Having an inhaler handy, along with clear written instructions and emergency phone numbers, empowers both you and your support network to respond quickly and confidently. By combining vigilance, correct use of rescue inhalers, and readiness to seek help when red flags appear, you minimize the risk of severe asthma complications and gain peace of mind. Comment emergency now if you've ever needed immediate care during an asthma flare-up and want to help others recognize the warning signs. That wraps up our comprehensive dive into asthma. What it is, how it flares up, and the strategies you need to keep your airways open and resilient. If this breakdown helped you, give us a thumbs up, share this video with someone who could benefit, and comment below which insight resonated the most. Don't forget to subscribe and hit the bell icon so you never miss our weekly, science-backed health insights. Until next time, stay informed, stay proactive, and breathe easy.